Have you ever wondered why that pesky upper neck pain seems to team up with those relentless headaches, making your day feel like an uphill battle? Well, you're not alone. Today, we're delving into the intriguing world of upper neck pain and headaches. What causes this duo to strike, and what can you do to find relief? Stick around as we uncover the answers in this video. Muscle tension and strain. Muscle tension and strain in the neck and upper shoulder region, often referred to as tension neck syndrome, can result from a variety of factors, including poor ergonomics at work, stress, and lack of physical activity. When muscles in this area become tight and strained, they can create a cascade of discomfort, including localized neck pain and tension headaches. The pain may be experienced as a dull, aching sensation, and it can radiate from the neck up to the base of the skull and even around the temples. Poor posture. Poor posture is a prevalent modern-day issue, often exacerbated by extended periods of sitting at desks, looking down at smartphones, or working on computers. When individuals consistently maintain incorrect posture, it places undue stress on the muscles, ligaments, and joints of the neck and upper back. Over time, this strain can lead to upper neck pain and tension headaches. Postural problems can cause the head to shift forward from its natural alignment with the spine, placing extra weight on the neck and upper back muscles, which must work harder to support the head's weight. Stress and anxiety. Stress and anxiety are common triggers for upper neck pain and headaches. When individuals are under stress, their bodies tend to respond by tensing up muscles, including those in the neck and shoulders. This prolonged muscle tension can lead to persistent discomfort and pain in the upper neck. Furthermore, stress can contribute to tension headaches, which often feel like a band tightening around the head. Anxiety can also lead to shallow breathing and increased muscle tension, exacerbating neck pain and headache symptoms. Neck injuries. Neck injuries, such as whiplash from car accidents or sports-related trauma, can result in upper neck pain and headaches. Whiplash occurs when the head is suddenly and forcefully jerked forward and backward, causing strain to the muscles, ligaments, and soft tissues of the neck. This can lead to acute neck pain, stiffness, and headaches that often develop a day or two after the injury. In some cases, the pain and headaches may persist as chronic issues if the underlying damage is not adequately addressed. Cervical herniated disc. Cervical herniated discs can be a source of upper neck pain and headaches. These discs, located between the vertebrae in the neck, act as cushions and shock absorbers for the spine. When a disc hernia tears, its soft inner material can push out through a tear or rupture in the outer layer, leading to compression of nearby nerves or the spinal cord. This compression can cause localized neck pain and can also refer pain to the head, resulting in headaches. Cervical arthritis. Cervical arthritis, also known as cervical spondylosis or degenerative disc disease in the neck, is a common cause of upper neck pain and headaches, especially as people age. This condition is characterized by the wear and tear of the cartilage and bones in the cervical spine, leading to the formation of bone spurs, reduced disc height, and inflammation. As the discs and joints degenerate, they can put pressure on nearby nerves and lead to chronic neck pain. Migraines. Migraines are a complex neurological condition that can often be associated with upper neck pain and tension headaches. While the exact cause of migraines is not fully understood, it is believed that changes in blood flow and brain chemistry play a role. Muscular tension and stiffness in the neck and shoulders can trigger or exacerbate migraine attacks in some individuals. This is often referred to as cervicogenic migraine, where tension and discomfort in the neck may precede or accompany the migraine headache. Addressing both the muscular tension through relaxation techniques and the migraine itself with medication prescribed by a healthcare professional can be a holistic approach to managing this type of headache. Temporomandibular joint, TMJ, dysfunction. Temporomandibular joint, TMJ, dysfunction can contribute to upper neck pain and headaches. The TMJ is the joint that connects your jaw to your skull, and problems with this joint can lead to a range of symptoms, including pain in the jaw, neck, and head. TMJ dysfunction can cause tension in the muscles around the jaw and neck, leading to referred pain in the upper neck region. This referred pain can sometimes be perceived as a headache, often localized to the temples or behind the eyes. Dehydration. Dehydration can be a surprising but significant contributor to both upper neck pain and headaches. When the body lacks sufficient fluids, the muscles can become more prone to cramping and tension. This muscle tension often affects the neck and shoulder region, leading to discomfort and pain. Additionally, dehydration can result in decreased blood volume and circulation, which may impact the flow of oxygen and nutrients to the muscles and brain, potentially causing headaches. Infections and inflammation. Infections and inflammatory conditions that affect the neck can lead to both upper neck pain and headaches. For example, conditions like meningitis, which is an inflammation of the membranes surrounding the brain and spinal cord, can cause severe neck stiffness and headaches. Cervical lymphadenitis, an infection or inflammation of the lymph nodes in the neck, can also result in neck pain and discomfort. In some cases, infections in the throat or upper respiratory tract can cause referred pain to the neck and head regions. These conditions often require prompt medical attention and treatment with antibiotics or antiviral medications, depending on the underlying cause. Nerve compression. Nerve compression in the neck, particularly the compression of occipital nerves, can lead to referred pain that manifests as headaches. Occipital neuralgia is a condition where the occipital nerves, which run from the base of the skull up to the scalp, become irritated or compressed. This irritation can cause intense, shooting pain that starts at the base of the skull and radiates towards the top of the head or behind the eyes. It can mimic the symptoms of tension headaches or migraines. Common causes of occipital neuralgia include muscle tension, neck injuries, and even tight hairstyles that pull on the scalp. Don't hesitate to leave a comment and share your ideas with us. Thank you, guys, for watching.